Hello, welcome to another episode of Aware and Care. I'm Madhvi Vatula. I'm joined by Dr. Ambika Nair, who's the Chief Consultant and co-founder of Shantigram Group of Companies located here in New Jersey, and they also do virtual consultation. As a human body, this body goes through different changes at different parts of your stages of your life. From birth to the final stage of life, there are phases of pains, discomforts, and agonies, which needs to be treated, especially through herbal remedies. And that's what Dr. Ambika Nair and her entire team specializes. Let's welcome her to the show today. Namaskaram, Doctor.
Namaskaram. How are you?
I'm doing very good, Dr. Nair. Dr. Nair, I just mentioned that from birth to the final stage of life, every phase, body goes through different changes. There are certain discomforts which happen once a month. There are certain discomforts which happen weekly. There are certain discomforts which happen maybe some point in life. But there are certain things which come on regular basis. The frequency is small. One of them is a headache, pain in the head. It comes in different variations. Some of us call it, a tension headache. Some call it stress headache. Some call it water deficiency, or if you're hungry, also you have headaches. Today, we'll try to understand what exactly is headache and the different types of headaches.
Headache, it's a very nice topic you're giving me today. Okay. Headache means people, it's just a headache. Actually, it should not be taken into that, simple way. Headache means, it can be a predominating symptom of other diseases too.
Mm-hmm.
Actually. So we have to see what is the root cause of that. Some people, when a patient comes, I will start like that. When a person comes to your clinic, what you're supposed to do is that you have to see how is his physical health, how is his mental health, whether he is perfectly sleeping properly, digestion perfect or not, whether he has any sinus issues, whether all his three doshas are balanced or not, whether any other, a brain tumor can be also one of the cause of the headaches. Sinus headaches are there, trigeminal headaches are there, migraine headaches are there, indigestion headaches are there, sleeplessness. And if you talk continuously for a long time, you can see in politicians and, public speakers and all, continuously they speak for a long time means, sometimes they will have real headache. That is with overusing of the vocal cord also. And continuous, it is a vata related actually. And there any constipation is there, any bleeding sometimes in ladies, whether it is with the menopausal, any headache, some before the periods also, premenstrual headache, some PCOD people also will have so much of headaches, like moving pain also. So these all we have to see why they are having any other abdominal tumor, any related with the cancer. So it's a very vast subject actually. Headache is not a small thing, even though we will think that headache is like a very small thing. And we divide it into primary, secondary, tension, we have, we differentiate it actually.
Okay.
And we see the causes of the headache also.
So in today's topic, we're going to talk of headache. Seems like the topic itself is a headache with so many types of headaches. So we don't even know where to start from. So Dr. Nair, like I just asked, how do you differentiate between a chronic headache and how do you understand the frequency of it and then feel concerned? Oh, it's because of periods. Okay. So we know once a month it's coming. Because of its constipation, then you know that once you go to the bathroom, your headache will come down. So there are certain ways of understanding what is chronic and what is not. So what is a chronic headache?
See, like some people, because work and environment, you have to understand actually. If somebody is standing, ladies working in the kitchen and even chefs and, in a furnace, so many people work in that. So that is heat related. So in that, you can see if you check their blood pressure also, you can see their blood pressure is okay on the higher side also. So that they will be dehydrated also. There are so many reasons with that, like blood vessels get dilated and, like muscles also, tension headaches will come with that. So the work environment, that is also more important. We have to say that, okay. Then, like in certain food, after consumption of certain very sour food, like very... very heavy food. Sometimes, you overeat with ice creams. So that will be related with, like ice cream means, that your kapha increased so you will have like headaches. But if the headache comes, like once, see, without a reason, sometimes, once they go out. See, we have like, we have a lot of clientele, and I have treated a lot of patients also in this big journey for me. So, they will tell that when we go out, we get headaches. So that is related with the sun. So slightly, their blood pressure goes a little bit high. They feel they cannot even look at the sun. They cannot look at the light, all those things, So it is all different modes.
Okay.
That's the, yeah.
So when we are talking about, there's so many types of headache. In fact, people have headaches after sex also. So those different variations of the headaches are coming in. So what exactly is the body component? Is it always Vata related, or is it age? Why is it different?
Pitta, Vata related. See, if like, we have like age related, I'll tell you. Children, if they don't want to do their headache, they will tell the mama, I have tension headache. I am having headache. Okay. Even with the fever also, you can see how the headache will come. Okay. If you are losing so much of blood also, you are having headaches. Even with the fatigue, with the depression, anxiety, fear, everything comes with a headache. 90% they will tell that I have a headache actually. Cervical spondylitis. And, like any injury on the head, like that also. Any injury in the ear, any pain in the ear, headache will be there. So this is all a predominating symptom. Actually, we have to find out the root cause actually.
So you're saying that every body part, including the nervous system, digestive system, the respiratory system, anything which has a problem could also lead to a headache, and headache could also lead to finding solutions through different parts of the body as to what is the problem. Wow, this is very complicated.
And even glaucoma patients, eye issues.
Eye issues also, wow.
Yeah, and sometimes bleeding will be there in the eyes. You can see. Some days, like you can see recurrent headache. Sometimes, once in a blue moon it comes, you can see that they around the eyes, they will have little bit of like a blackening with an internal bleeding. But it comes maybe once in a blue moon. It will not come. Maybe after like 8 years, 6 years, they get it. But some people, when it is recurrent, continuously coming and bothering in your normal life, then you have to see that there is really some problem.
Okay. Now, Dr. Nair, talking about headaches, the different levels of pain and variations of pain. Oh, my head is paining. Now, which part of the head is paining also matters, I'm sure. There is types of pain, pinching pain, throbbing pain, pulsating pain, or just forehead pain. Can we just touch base on those different types of pain and degrees of pain?
Yeah, that, like some people will tell, like a rebounding. See, what happens, they may be taking a lot of like painkillers.
Okay.
Okay, so again, after some period, again it rebounds. So that painkiller itself, that will be related because whatever you eat, it will be, like absorbed by the liver only. So this is, like even little pulsating pain will be there. And in one area it will be there. Very cruciating pain. You feel that as if somebody is putting a knife on your, like in your ear.
Okay.
And, like it radiates like this, especially on the jaw area. Because in the trigeminal neuralgia, it will be like that. Whole head will be freezing. And sometimes when you go, without any cap or anything, in the, like in the snow or very freezing temperature, you know that how the, like the head will become like numb pain. And, like on the bones and all, sometimes it will be the pain, the degree, like we call it as like out of 10, how much, like that. Okay. So like a pulsating pain, like a radiating pain will be there. Sometimes it will be like how you say that, the flow of wind, like the pain just radiates. And it really only on the peripheral side. Some pain will be very cruciating on the bones.
Okay. So
like chiseling, like somebody is cutting, that much pain will be there. And with the gurgling sound also, like fibroid uterus and all, because when the gas consumption
anemia,
will be,
and for that also.
very, very, and like grinding teeth at night, that will also there. Influenza, panic attack, children, people also will get into, and overusing of like alcohol. If you, that is seen mostly, you can see that
Then
Actually,
hangover.
if they
So we know
drink
how
a
to
lot,
deal with
they cannot get
hangover
up in the
related
morning.
headache. Okay,
Sometimes
so
it
Dr.
will be
Nair,
clotting of the blood also.
yes. Okay. So I'm feeling maybe we could be making this into a 2-episode thing where we can understand about more different types of headaches. But I guess the treatment process is always about herbal healing. So once a patient comes to Shantigram, you have made a diagnosis chart, his pulse reading and everything that has been done as to why this headache is happening. So what kind of treatments are recommended and what kind of detoxification process is done to cure headaches?
Madhavi, we have to see why the headaches are there.
Mm-hmm.
Whether it is related with, like even some people will get after the surgery also.
Okay.
Okay, so we have to see the root cause and accordingly we go for the Panchakarma. Everybody, some people does not need any Panchakarma, even with the diet. Some days, they may not be sleeping properly, so that headache will be there for a long time.
Mm-hmm.
Okay. You see, on the burning sensation, they will tell, especially on the, like upper part of the crown of the head.
Mm-hmm.
So we give them Shirodhara and Shiro Abhyangam, Shiro Vasti is given to people with all this, if it is on the head, like more on the head, it all depends upon where it will be. Pain is entirely different, like so many types of pain it will be. So accordingly we go that some Karna Puranam will be given because that pulsation will be there.
Pulsation
They will tell that we can hear how the brain is like a
pumping.
tongue like that, like a bounding pain will be there.
They can feel the pulse.
Yeah, Nasyam is given.
Mm-hmm. Nasyam is also given. So maybe I thought it was only because of sinusitis or something.
No. Because this headache can be because of the sinus also.
Okay.
And so many very chronic sinuses are there. It's not like a small sinus actually. Mucosal thickening will be there.
Okay.
So such cases, very bad influenza. So
doctor, even if I have to put it in a plain, simple question as to, are all types of headaches curable or some headaches need surgery?
It all depends if it's a brain tumor or anything like that. If it is according to the stage of the patient, if any bleeding is inside, any head injury or anything like that. See, it all depends. Surgical intervention is always when it is needed.
Extreme cases.
Okay, so so many people with epilepsy also will come to us, with a severe headache and all. Okay, so overuse of medications also it keep like that. They cannot focus, they say that.
That's interesting. So today, friends, we're talking about headaches and we just touched based on different types of headaches. And the human body, any problem in any part of the body could create a headache. Even a fingernail which is chipped off and it, blood is coming off from there, then there is a headache for that also. There's a reason associated with that. So today, we also touched base as to what kind of diagnosis is done and what is the treatment process that happens. Now, let's also talk about some foods. If headache is hereditary or you feel that it's a chronic case, what kind of foods calm a person from headaches?
We will be telling them avoid acidic, acid creating foods. Especially whatever you eat, it should digest and assimilate in the body. Overeating, we will not allow them. Sattvic food, like mostly khichdi, buttermilk will be given to them. And we see that, whether his mind, a headache comes at night. Some people tell that only at night when they sleep, they get headache.
Is it? Oh.
Okay. Yeah, so many people will have like that. Okay. So there will be, whether their environment is okay, what's the real cause of that. Then we tell them, early food, not very late dinner. And
so, doctor, I do see that we are finding it, we have coming to a part of the conversation where it's becoming a little difficult even to prescribe or give over-the-counter suggestions to any of our viewers right now, because we have to associate the pain to a particular reason as to why it is. Lack of sleep, alcohol, overdriving, or, tension or something. And then accordingly, the medicine is prescribed to calm the mind or the situation to reduce the headache. So Dr. Nair, you just mentioned that, acidic food should be reduced and avoid it also as far as possible. So are there any foods that we use on daily basis that can help in reducing pain, especially headache, maybe like cinnamon or turmeric or something?
No, we tell them, like when they sleep, that we will give them like 1 teaspoon of like a normal ghee
Mm-hmm.
in warm water or little bit of milk if the person is not having any sinus issues. So that will really, help him not to have any constipation, and it
Mm-hmm.
will calm him down also.
Mm-hmm.
And when they are having a real headache, especially in the daytime, see, there are so many pills available, like Sudarshan is there, Surya Prabha is there,
Mm-hmm.
even Dhanantaram pills will help a lot. But then we tell them, like you can apply little sandal paste, sandal powder paste on your forehead. If it is a normal headache, actually.
Wow,
Okay. Yeah. For acute headaches, that Nasya is done for all these people. And the diet, will come. Okay.
Mm-hmm.
Carry on.
That's interesting. Doctor, you just mentioned about sandalwood paste. I was just thinking that some people have also perfume-related headaches, But
Yeah,
otherwise,
high perfumes, because see, they are allergic, like a kapha people. They cannot go.
okay.
That's what I told influenza. So they cannot stand with that actually, any smell. So where they are working is more important. Some
Mhm.
people will be drinking, the other person will be like having severe headache and vomiting in one side.
Wow.
Okay. So one enjoy, one suffer.
One suffers. And that is the beauty of this human body, that everything is possible, but only thing we have to follow the right conditions.
Spicy food should be avoided.
Mhm.
Fatty, deep fried food should be avoided actually. More, like a cucumber, watermelon. Now it is summer, that's what I'm telling you. Okay.
Mhm.
Like a days can be included in your diet.
Mhm.
Okay.
What
Massage
about
with
water?
water, a lot of water. Even coconut water is very good,
Mhm.
He can apply, like a massage, warm coconut oil if you don't have any other oil, or Brahmi
Mhm.
oil on your head, on your foot also. So that will relieve, vitate your pitta a lot actually. And even, like for like Nasim is always, like a routine you can do at home. So that will help you a lot actually.
Yeah. Now, doctor, we've come to this part of the country. We are living in different kind of conditions, and different kind of medications today are available globally. From where we've come, we've all heard that headache means it's always Amrutanjan or one headache tablet. Now, with this conversation, I've also understood that there are different types of headaches, and there are only temporary reliefs that come through these little balms or painkillers. To know the crux of this problem, as to why this chronic pain is happening, a visit to the doctor is a must, to your own personal doctor or to Shantigram Wellness Center. And this program is all about healing yourself internally and through mind and body and soul through herbal remedies. And that's what this program is all about. So, Dr. Nair, any parting words for our viewers, giving some assurance that headache is a treatable
Actually,
condition?
we do, my mother, you can see in our clinic, like we get a lot of chronic like headaches. They have this headache for like 40 years, 35 years. They were on migraine pills. So we are taking care of them actually. Oh, they say that, we suffered a lot. We tell them, like hot ginger tea is very good. You can put a little bit of black pepper in that, pinch of cinnamon, and one clove, and a half teaspoon of fennel seeds. So that will help a lot. And if you are having like a sinus and all those things, you can inhale eucalyptus steam also. Like that is all for kapha headache. Vata, we had to put oil, and you're doing abhyangam. Whatever you can do at home, you should do it actually. And they're doing, little bit of yoga, like anulom vilom, and taking a steam every day. This all helps everybody actually, not only like coming to the doctor, but like a self-awareness also.
Also, it's important.
Yeah.
So we came to that part of the program where doctor has given us certain remedies, home remedies to try for headaches. And if it does not subside with all these little remedies, please go and immediately take a consultation and find out the root cause for the problem. For temporary problems of headaches, I think these remedies are very good enough to try it and heal ourselves. Thank you so much, doctor, for today's episode. I'm still wondering about so many other types of headaches that are coming, and we will try to cover those in the upcoming episodes, whether it's migraine, trigeminal neuralgia, or occipital, and understand as to where this goes and what happens if it goes untreated. And we appreciate your time today. Thank you so much.
Thank you so much.